More than 76% of patients start on Google when they are looking for a healthcare provider. That means the moment a person decides they need private care, they open a search bar. And the clinics that appear in that moment are the ones that capture that demand. The clinics that do not appear simply do not exist for that patient. In this video, I want to walk you through what Google Ads actually is for a private clinic, how the auction works, which campaign types matter, where the compliance risks sit, and why the platform has become more important in 2026 than it has ever been. Google Ads is Google's paid advertising platform, known until 2018 as Google AdWords. Today, it covers search results, YouTube, Google Maps, Gmail, and the broader display network. The core model is pay-per-click. The clinic pays when someone clicks, not when the ad is shown. In traditional advertising, you pay for visibility, regardless of response. Here, you pay only when a potential patient takes action. For private clinics, the key distinction is between search and display. Search ads capture patients with clear intent. They are already looking for a service. Display builds awareness. Most patient acquisition starts with search. Every time a patient searches on Google, a real-time auction takes place in milliseconds. Step 1 is keyword matching. Does the clinic's keyword match what the patient searched? Match type determines quality. A patient searching private GP appointment today is significantly closer to booking than one searching what does a GP do, even if both trigger the same keyword. Getting this right is one of the first places clinics either waste budget or capture high-intent traffic. Step 2 is quality score. Google does not give the top position to the highest bidder. It also evaluates expected click-through rate, ad relevance, and landing page quality. A well-structured clinic account can outrank a competitor, spending significantly more. Step 3 is ad rank. Google combines the bid with quality score and contextual signals to determine whether the ad appears and where. Improving the landing page, tightening keyword structure, and refining ad copy can be just as effective as increasing budget, often more so. Step 4 is the click. The clinic pays the minimum needed to hold position above the next advertiser, not always the full maximum bid. From that point, performance depends on what the patient finds. A strong healthcare landing page loads quickly, works on mobile, names clinicians, shows CQC registration, and makes the next step, inquiring or booking, completely clear. There are 4 Google Ads campaign types that matter for private clinics. Search campaigns are the foundation. Text ads that appear when a patient actively searches for a service, like Private Dermatologist London. They capture patients already in decision mode, which is why search delivers the strongest return for patient acquisition. Performance Max is Google's automated campaign type, serving ads across search, display, YouTube, and maps from a single campaign. For clinics, it requires caution. Less visibility into where ads are running makes compliance harder to manage. It should support a search campaign, not replace it. Display ads, banners across the Google Display Network, are useful for awareness when launching a new location or service, but convert at a lower rate than search. And local service ads appear above standard results with a Google screened batch, charging per lead rather than per click. Where available in the UK, they are valuable for high-intent local searches, but should sit within a broader strategy, not stand alone. Healthcare advertising on Google carries 2 separate compliance obligations. Meeting one does not satisfy the other. The first is Google's healthcare policy. Medical content is classified as YMYL, your money or your life, with stricter standards on clinical claims and treatment outcome language. Ad copy and landing page must be consistent. An ad that promises same-day results needs a landing page that supports it precisely. If it does not, the account faces disapprovals or suspension. The second is the ASA CAP Code, separate from Google's policy, and UK clinics must satisfy both. It governs treatment claims, testimonials, and prescription medicine references. Aesthetic clinics and providers making clinical claims need to audit both independently. EEAT, experience, expertise, authoritativeness, and trustworthiness, affects paid campaigns directly because Google Ads uses landing page quality as part of quality score. A weak landing page is a commercial problem, not just a compliance one. It raises cost per click and makes it harder to hold position. In practice, EEAT for a clinic landing page means named clinicians with GMC, GDC, or HCPC credentials visible, CQC registration displayed, accurate treatment descriptions, transparent pricing, and a visible complaints policy. The gap between clinics that do this and those that do not is measurable in both cost per click and cost per acquisition. These three channels are connected, but they do very different jobs. Google Ads is immediate. Campaigns go live in days, reaching patients already searching for a service. When the budget stops, the traffic stops. SEO takes 3 to 12 months to produce consistent results, but once rankings hold, traffic continues without a per-click cost. Paid social has a lower CPC, but lower intent. Patients on Meta are browsing, not searching. It works for awareness and remarketing, not for immediate bookings. The best patient acquisition strategies combine all three. Two shifts make Google Ads more important for UK private clinics right now. The first is demand. Private healthcare use rose from 9% in 2023 to 16% in 2025. When patients decide to go private, they start on Google, and that window is increasingly competitive. The second is AI overviews. They now appear on roughly 43% of health searches, and when they do, organic click-through rates drop sharply. Google Ads often appear above them, protecting paid visibility where organic clicks are declining. One final point. Without proper conversion tracking, clinics lose 30 to 50% of the data Google needs to optimize. Budget spent on incomplete information produces weaker results than the account should be delivering. If you are not sure how your clinic's Google Ads account is configured, or whether it reflects the quality of the clinical service you provide, UpMedico offers a free initial consultation, no obligation, specific to UK and Irish private healthcare. We will look at your campaign structure, keyword strategy, compliance posture, and conversion tracking, and tell you where the priorities are. Book yours at upmedico.com. The link is in the description.